Dr. Demito here. I've created this presentation to discuss the four I's of disease. As you begin advanced pathophysiology, you will begin to learn how the disease process occurs, and it goes to the cellular level. And it's a very important class. I think one of the most important classes that you'll take because everything that you do in healthcare is going to be focused on the pathophysiology of the disease process. The treatments that you provide will go back to the disease process at a pathophysiologic level. The four I's illustrate the concepts that impact the development of a disease process. So those four I's are inflammation, immunity, infection, and injury. These four concepts can work on the disease process or create a disease process at an individual level, or they can work together. So let's take a disease process. Let's take psoriasis. Psoriasis is an autoimmune disease, so the immune system is not working properly. When we have an autoimmune disorder, either the immune system is hyperactive, which is how it is most of the time, or it is underactive. So it can leave them open to disease due to the immune system not functioning properly, as you would see in someone who has AIDS. So their immune system is not able to prevent disease as it normally would. If you have a patient who has a hyperactive immune system, such as in an autoimmune disorder, their disease may actually, or that their immune system is promoting processes to take place. So let's take an autoimmune disorder. Psoriasis. Psoriasis is an autoimmune disorder that causes the proliferation of skin cells. So the body creates skin cells at a faster rate than the body sheds skin cells. So those skin cells, that's a tongue twister, the skin cells accumulate and form scales or plaques. And in the process of doing so, inflammation occurs. And that inflammation causes an area that may be red. Think about all of the cascades of events that occur in the inflammatory process. Red skin, itchy skin. The individual may scratch the skin and cause a break in the skin. That would be classified as an injury. Now that injury is there, and that injury has opened a portal for bacteria. If that bacteria invades the tissues, now you may have infection. So all of these concepts can influence or be the resultative factor in the disease process. And this illustrates that just a little bit more. All right, so let's look at inflammation. Yes. It's a localized physical condition in which part of the body becomes reddened, swollen, hot, and often painful, especially as a reaction to injury or infection. So think about when your body goes into a state of inflammation. Maybe you have fractured your arm or injured your leg. Something has caused that cascade of events to occur where chemical mediators are released and that area becomes inflamed. That's a compensatory mechanism from your body to try to stop whatever process is going on in your body. Try to immobilize a joint or prevent bacteria from invading a wound. So inflammation in itself serves a purpose, but when it's out of control, it can also be detrimental to the patient. Let's look at another one. Immunity. Our immune system is a network of intricate stages and pathways in the body, and it protects us against harmful microbes and diseases. It recognizes foreign invaders like bacteria, viruses, and parasites and takes immediate action. So if we have an intact immune system, that's a great thing. It sends out all of its chemical mediators and rounds up the troops, and its focus is to prevent you from getting sick. But your immune system sometimes can't prevent that from occurring because the invaders may be stronger than your immune system, or your immune system may not be functioning properly. Let's look at injury next. A permanent or semi-permanent disturbance to a structure or function of any part of the body caused by an external agency. It can be mechanical, thermal, chemical, electrical, or radiational. It can be applied to damage caused by infecting organisms or physical trauma. So you have been injured, you've been in an accident, you've broken your leg, or you've gotten a burn. Again, we go back to those chemical mediators. Your body knows that something has happened, and it calls out to all of the soldiers in your body that are meant to come back to that site of the injury and prevent it from getting worse. And the last one is infection. Invasion and multiplication of microorganisms like bacteria, virus, and parasites that are not normally present in the body. So your body develops an infection. And let's go back to something simple, a simple concept like nursing 101. If we're going to give an injection, we wipe the area that we're going to inject with an alcohol swab. And we do that because normally the body has all different kinds of bacteria on it. And it's normal. It's supposed to be there. It's not a problem, as long as it doesn't invade the skin and get into the system. That's why we use that alcohol swab, because we don't want those bodies to potentially have a portal of entry into the body where an infection can develop. Then we're going to have an inflammatory process that we have to address. All right, let's go back and look at all of the concepts together, and let's put it together. All right. When you have a patient who presents with a condition, you need to identify what disease process is going on. And that is defined as developing a differential diagnosis. And that's the what ifs. I like to akin this to a investigation. Okay, we're doing a CSI investigation on this patient to identify what's going on, what caused the disease, or what the disease is. So we need to take all of the clues that we obtain from the patient's history. We also have to take the clues that we get from the presenting condition that we see with our eyes and any laboratory analysis that we do. And then we have to identify what's going on. If we have an elevated white count, perhaps there's an infection going on. But then again, you can also have an elevated white count from an injury or from inflammation as well. So we take all of those pieces and we put them together and we decide what's going on with this patient. What is the disease process? Once we've identified what the disease process is, then we're going to determine the treatment path for this patient. Now I'm going to go back to my original disease process of psoriasis. So let's keep it simple. We have a patient who presents with psoriasis. They have an autoimmune disorder which is causing the proliferation of skin. The skin cannot shed quickly enough, so the skin cells develop scales or plaques due to, and then as a result, you have an inflammatory process that takes place. So how are we going to address the root cause of the disease process? Now, initially, you may want to try to use steroid creams to bring the level of inflammation down. But ultimately, we know that people who have psoriasis, and you'll learn this all in pathophysiology, have an issue with their T cells. So their T cells are not functioning properly. And it is considering that there is an invasion going on when there isn't an invasion going on. So we've learned throughout the years that if a patient with psoriasis is prescribed a biologic that will quiet down the proliferation of T cells, that the process will not result in the proliferation of skin cells, which will not result in an inflammatory process, which will hopefully reduce the risk of injury and infection. So it all goes back to the mechanism of the medication that we are choosing to treat. And I think you'll learn this. It's a fascinating fact, and you'll learn this as you move forward and learn more about pharmacology and more about disease. The drugs that we choose to treat a specific condition interact at a pathophysiologic level to interrupt a process that is out of control, or to prevent bacteria from getting into the system, or prevent bacteria from proliferating. So it will interfere with the process that allows bacteria to multiply. So that's an antibiotic, and antibiotics have different mechanisms of action. For viruses, let's take Tamiflu. Tamiflu prevents the virus from replicating itself. So virus cannot live in a body on their own. They have to invade a healthy host cell, and it's in that healthy host cell that they duplicate themselves. Well, Tamiflu, in theory, prevents that from occurring. So I hope that I brought this to light, how these four factors influence the disease process, and just touched on how we identify what the disease process is. And it all goes back to the pathology of the disease process, and pathophysiology, which is the development of disease at the cellular level. So I hope you found this helpful.